with increased connection comes increased communication, which is essential, in particular when it comes to patients learning about and understanding novel treatments.
There's all this such exciting evolution of therapy that having an understanding of the basic science and being able to build on that and explain that in as simpler terms as possible so that people can really understand it is, I think, one of the most important parts of my job.
I think it's nice that we have these long-term relationships because with all of the different options, I think it's important not to rush people through that decision-making process, right? Like, I think you give information, you let that set, you ask what do you think about this? Hey, you're here in clinic right now. You don't need to tell me exactly what your decision is right now. I just want you to know what your options are. And like revisiting things, asking over time how their life has changed. And are you thinking about any changes in treatment because of any lifestyle changes? It's based off of where they're at month to month. So I think that's nice to have that long-standing relationship as you're having those discussions, because sometimes you need some time to sift through the information.
And from the patient side,
that's me again, in conversation with Brittany.
Having those conversations with someone I trust and have had a relationship with over time helps me feel more confident in whatever we arrive at, because the process feels really well informed through a trusted relationship. What feels challenging is how to account for the value of that trusted relationship over time in the way that we account for value of an annual bleed rate or a quality of health metric. Where in the input matrix do we have a data set for the value of the relationship between the clinician and the patient over time, so that the shared decision-making process is as richly informed as possible? Is it crazy to think we could ever have something like that?
Hey, never say never. I spend a lot of time with our patients outside of clinic, at events and chapter events and camps and all of that. And I found that it makes a huge difference in trust. Like, they know me on a more personal level, and it would be interesting to look at data related to that and hear from them, whether it's